Happy spring, everybody. Thought I'd do a newsletter via video rather than a bunch of text this time. I will have some text below this so you can read up on things that are going on in the practice. But I hope you're enjoying the spring. Warmer weather is definitely on the way, and I'll be missing skiing and looking into mountain biking and all the other spring activities coming up here. It's been a challenging time over the last few weeks watching the horrific tragedies happening in the Ukraine and really hoping that things will turn around in a favorable way there. So sending my love to all those families that are suffering and hoping that Russia will back down and turn away from this atrocity that's occurring. The pandemic updates, currently in a lull, which is great news. The worrisome thing is there is a flare going on in England and Europe with what we would call the BA2 variant, which is an Omicron variant. Currently in the US, we're seeing 23% of cases of this type, and I would imagine in a few weeks we'll see it be the dominant strain. What does this mean? It is a more contagious strain. It is going to, spread like wildfire, but hopefully not quite as bad because we have such a higher level of immunity from vaccines and natural infection. I think that wearing a mask in public places is always a good idea, particularly if it's crowded. And depending on recommendations coming down the pipe from the CDC, we may want to up our game a little bit more. But I'm hopeful this will be a mild surge and nothing that really sets us back in terms of not being able to go out in public, all those kind of crazy things. The antiviral Paxlovid is now available, and I've written a few prescriptions for individuals that have had a positive test and some symptoms. If you really have minimal symptoms, such as just a runny nose, probably not worth doing it, particularly if you're low risk. But if you're a more elderly individual and have some chronic health conditions, definitely give me a call within the first 2 to 3 days of a positive test, and I can call that in for you. It's a 5-day course, twice a day. Can reduce the risk of hospitalization, reduce the risk of worsening symptoms as well, of course. I'm in terms of boosters, they're recommending a fourth booster for many people. I think that that is, again, worthwhile considering for those of you who have higher risk factors, diabetes, history of cancer, immunocompromised condition, 70 or older would be my thought in terms of doing a fourth shot. I think I am personally going to wait until a booster that has included some of the newer Omicron variants is available, and I'm hopeful that that will be coming up here in the spring. So we'll keep an eye on that, and I'll let you know when that might be coming down the pipe, whether it's through Moderna or Pfizer. Again, masks, just in crowded places. In our office, we're lightening up quite a bit. We'd like for our patients to wear them as they come into the waiting room. We just want to ask you if you've had any symptoms, and if you're all clear when you come back to the exam room, you can take that off, and I still have the air filtration going. So we're, wanting some initial masking, but then you can take down your mask as long as you're feeling good. Practice updates. Emma has gone home to be with family. She has one of her parents is having some challenges in being there for them, and we wish her the best. She did an amazing job here, and she will still be involved with us peripherally in terms of offering nutrition consults for patients that are looking for opportunities to lose weight or balance their diet, balance their microbiome, etc. Within this newsletter, you'll see a link to email her, and you can set up some Zoom consultations if you'd like to connect with her or even just say hello. Amy Monroe has come on board to fill her position. She comes to us from Human Universal Health Institute just down the street, has a lot of experience helping to manage that center, and is also a breathwork facilitator, has a lot of experience in skincare from various plastic surgery centers she's worked at. So she'll also be doing some services on the side, that being the breath work, as well as some laser and other skincare services. We will be offering some amazing group breathwork sessions, which would be great in terms of mindfulness sometime in the near future. And if you're interested in doing that, just call the office or email us and we'll let you know the details on that. In terms of other things, we continue to do a lot of post-COVID syndrome therapies. We've had great success with glutathione IV combined with NAD IV, also periodically adding vitamin C and some of our other B complex, such as past vitamin. If you're suffering from fatigue, brain fog, loss of taste or smell, just feeling off, let us know, and we can do a series of IVs that can dramatically improve your symptoms there. If you have COVID currently, we obviously don't want you to come into the office, but we can set you up with nebulized glutathione, and you can buy a neb on Amazon and use the same compound that we give IV, diluted with sterile saline and nebbed into the lungs, which can really reduce the inflammation, cough, and get you feeling better, and I think potentially reduce your risk for long COVID syndrome. Many of you are complaining of not meeting your weight goals following New Year's Eve resolutions. I'm not quite meeting mine either. So I've been sticking myself once a week with this peptide called ozembic. There's a generic version of it, which we get very cost effectively from another compounding pharmacy. And you inject it once a week. It reduces your appetite, and it can help you lose 10 to 15 pounds in a few months, sometimes quicker, depending on how aggressive you are going up on the dose. So it's a tiny little insulin needle once a week. We can teach you how to do it, and it can help you meet your goal. It also has some other great benefits in terms of cardiovascular risk reduction, glucose reduction, etc. It was originally designed as a diabetes med, but now it's been FDA approved for weight loss as well. We can combine that with a couple compounds called MIC and methyl B12, which can further enhance your metabolic rate, and we offer that as well. And of course, nutritional coaching, lifestyle coaching, mindfulness can help with weight loss. Balancing your thyroid, balancing your sex hormones can help too. So we're here for you if you're wanting to tone up for the beach later, or just feel better and maintain a better body mass index. If you are struggling with stress and anxiety around this war and the pandemic and climate change and everything else that's hitting the fan, it's truly been a crazy couple of years. We continue to offer amazing therapies, including ketamine therapy. Ketamine is typically used for depression and anxiety and PTSD, even some for substance abuse or addiction disorders. But I'm finding that it's also very helpful for people that are in a state of, situational depression or anxiety related to what's going on in the world. So we can reboot you with that. It's a meditative, somewhat psychedelic experience. It's very safe, done on our sound table. You're monitored during this and can be very beneficial to, pretty much anybody, as long as we've got a reasonable reason to do it. And you can call to ask more on that, pricing, etc. We provide it at a very reasonable price compared to other centers. The other really cool thing is we can also do NAD, which is a vitamin related to B3, which can help improve serotonin, can help improve other neurotransmitters, also helps with mitochondrial function. It can be paired with ketamine, or it can be a standalone to help improve your general wellness. Some of the other benefits of NAD include improving mental clarity, facilitating brain regeneration, improving concentration, boosting neurologic function as mentioned. And then there may be some benefits in terms of reducing your risk of Alzheimer's disease. Ketamine has also been studied in terms of reducing risk of Alzheimer's disease. So combination of NAD with the ketamine may be a fairly powerful tool in terms of, folks that are wanting to go on the preventative strategy of Alzheimer's. So consider that as an option, and you can Google that up to see what I'm talking about in terms of some new trials on ketamine and the prevention of Alzheimer's. Cardiovascular screening, I'm really getting impressive results with the Cleerly heart scan. This is a scan that just came online about a year ago. I'm one of the few docs that is doing it. A lot of cardiologists are completely clueless about it, which is crazy. It will show whether or not you have a significant amount of soft plaque, which is the dangerous plaque that can rupture and cause an acute myocardial infarction, or calcified plaque, which is more stable. Additionally, it could show the amount of stenosis or narrowing in a particular artery, and if it is to a certain degree, I can refer you to cardiology for a stent or other intervention so that you don't go down the road of showing up in an ER with a heart attack. So it's a very proactive, preventative screen that I recommend considering for people over the age of 50, and especially for those who have any risk factors such as hyperlipidemia, past history of heavy smoking, diabetes, high blood pressure, et cetera. So keep that in mind. The Cleerly scan is what it's called. Not covered by insurance, but reasonable enough price at $600. So I think it's worthwhile doing. Cancer screening. This is colorectal cancer screening month. So for those of you who are over 50 and have not gotten a colonoscopy, let us know. We'll send in that referral. We'll make it happen for you. If you're due for one, it's been more than 10 years or beyond your recommended time for a repeat because of a polyp, get that done. We're actually now through the new guidelines recommending initial screening at 45. Does that mean you have to get a colonoscopy at 45? No, we have other options. And one of my favorites is the Cologuard, the DNA stool test. I've been offering that for several years now to patients who want to alternate between a colonoscopy followed by DNA stool and then another colonoscopy. But I think for a 45-year-old, if you want to start with a DNA stool test, like the Cologuard, that's great. And then we could do a colonoscopy at 50. If you want to go big and do a colonoscopy right out of the gates, that's cool too. But because of, I think, dietary factors and other risk factors, environmental toxins, we're seeing a rise in colon cancer rates throughout the country, and doing earlier screening is important. The African American population, unfortunately, is seeing a much higher rate of colon cancers. So I definitely encourage that particular group to be a little more aggressive in terms of early screening. That's got it for today's updates, my spring updates. Please read the rest of the newsletter details below if you have time, and let me know what you think about this video format. I think I'm going to keep it going. It's just a little more natural and fluid, and you can listen to it to put yourself to sleep at night, to bore somebody, or while you're driving. All right, take care, happy spring, and let's send out some good energy to the Ukraine that things will settle down there. Take care.